And so what I'm going to do today is give you just kind of a brief introduction to animal-assisted therapy. The mission of Intermountain Therapy Animals is to enhance the quality of life through the human-animal bond. Our motto is pets helping people. So today's goals: introduce you to the world of animal-assisted interventions. That's animal-assisted activity and animal-assisted therapy. I'll go into those a little bit more specifically. Describe the criteria for volunteering successfully as a team. Okay, just to begin with, get this out of the way. Does everybody know the difference between a service and a therapy animal? Yeah? Does anyone want to tell me? Thank you.
You and I have done workshops together before, and between Nancy and I here in Bozeman, we probably flip-flop calls from people weekly and for sure monthly with people confusing the service dog with a therapy dog. And my understanding to be, and it's a little bit confusing and it's a little bit mucky, because there's the American Disabilities Act, which states that a service dog is actually not a pet, it's a working dog. And it cannot be treated as a pet. It has to be treated as a working dog and a single dog in a household, not a multiple dog household. And it serves a purpose with somebody needing assistance for a physical, mental, or auditory or sight disability. Is that correct?
That's a good definition.
Sympathy, I think, is more when we're just sad for a person that we see as sad. But when we show empathy, I think we actually engage with the person, understand the underlying challenges that they may be facing. We may not know their story. In fact, we tend not to ask, what's wrong with you, or what disease process are you in, or what stage where you might be, but rather to be in their presence and acknowledge that sometimes life can be challenging.
Thank you. So along these lines, I have a question. As a great handler, and these all make a lot of sense, but how do you initiate the relationship as a therapy animal handler when you're going to a hospital, a nursing home, a school? What are the boundaries for opening up a conversation so there is a relationship?
Well, there's the initial approach. That's a good question, thank you. There's the initial approach, and we go when we're scheduled. We don't just walk in. We know when we're going. It's at a certain time on a certain day. And so I'll have Eli with me, and if it's a new person, I'll keep a respectful distance because you don't know how they're going to react. And I'll say, hello, would you like to meet Eli today? And if they're willing and interested, then I will approach them. And then after that, the visit kind of goes along. And you can gauge the person's interest. You sit yourself near them, not standing over them, because you want to get down on their level. If they're sitting, you sit on a chair next to them. And sympathy is kind of, to me, outside and a little bit condescending. Whereas empathy, you are listening, and the listening skills are key. Okay, commitment, very important. If you say you're going to be there at a certain time, you are expected, you need to be. Ethical maintains confidentiality. You may hear things about their lives. You don't share those. Some facilities will have you sign a confidentiality agreement, and that's fine. Demonstrates a solid, loving relationship with your animal. That's very important. If I were rough with him as I'm taking him around, that doesn't look so good. Not that I would be, but you are on display. I'm in my uniform, he's in his uniform. We represent animal-assisted therapy. Ask questions. Great way to learn about people. And willing to be part of the team. So you want to prepare carefully before visits, assess after. A lot of preparation for us is getting him clean, combed, teeth brush, nails. Poodalicious. And for me, maybe 5 minutes. You know.
We work with a variety of temperaments with our dogs, and what I found is in those categories, and I would actually add one more category, the dogs that love objects more than people or dogs.
Okay.
Because we do have very highly object-motivated dogs that would jump off a bridge for a ball. And out of all of those dogs, what I found over the years is if the handler is dedicated to their goal and is willing to put in the time, anything is possible, because I've had dogs and handlers surprise me. So do you remember that handler that I sent your way with the chocolate lab? And she was a little dog aggressive, but she really wanted to go into, I believe it was the READ program. And she really wasn't sure. She was kind of a young handler, a young professional.
Did I pass her?
You did, okay. And they're wildly successful.
I'm sorry, I've passed over 300 teams here.
They're successful, and the smiles on their faces, and her Christmas card of "We've made it, we did it." But she took 2 years of preparation, and her dog was very object focused, slightly dog aggressive, very, very owner oriented. But what she did is she dedicated her time into making a more well-rounded environment for her dog.
Nice.
And her dog is, when you were going over the bonus of dogs who get their jobs, her dog gets the job. And when her little bandana goes on, she walks in and she's just a superstar. And she absolutely gets it. And so I think it really depends on if the owner gets it and is willing to put in that time, really great things can happen.